Eye health is an important part to overall health. It's crucial to childhood development and independent aging for adults. Most people depend on clear vision. It helps them participate in their occupation, hobbies, and even to perform most everyday tasks. If any part of your visual system is not working or not conveying the appropriate messages to your brain, the vision suffers. This is according to advanced eye care. Well, today we are here to discuss eye care with our very knowledgeable and experienced optometrist, Mr. Shelton Ogingo. This knowledge, I believe, will enlighten you and transform you and help you make informed decisions matters eye health. My name is Caroline Debu-Abege, the founder and executive director of Gifted Gems. Karibu sana daktari.
Thank you so much, Caroline. I am honored to be here and so that we can discuss more about child health, eye health.
Thank you very much.
Yes.
Let's even start with the basics. Who is an optometrist?
Well, an optometrist is a primary eye care provider who is trained to examine the eyes, to diagnose and offer management for various ailments of the eyes, including those of the visual pathways. Yeah, so yeah, we are basically primary eye care providers.
Okay.
Yes.
All right. We talk about visual health, and sometimes we do not bring it close to heart that we should actually take care of our eyes.
Sure.
So today we want to have some enlightenment on visual health. What is this visual health?
Okay, that's a very important and good question. Visual health is the well-being of our eyesight, and this includes the functional well-being, that is how the eyes is able to transfer messages to the brain, and it also includes the structural well-being, whereby the parts of the eyes are okay. There is no deformity or any other defect that can affect the normal functionings of the eyes. So it is the well-being of our eyes.
Okay.
Yes.
You talked about the parts of the eye. So maybe in a quick way, what parts are you looking at? Okay.
So the eye is very complex. Actually, next to the brain, it is the other most complex organ in the body. Okay. So what we just see outside is the tip of the iceberg. It goes way into the brain and is connected to the brain via nerve that is called the optic nerve. But just to give us a little bit of the parts of the eyes that are common. So the front part of the eye, which is the transparent part, we call it the cornea. So it is what enables the eye to be able to take in rays. Yes, because our eyes is an optical organ, so it works with the rays. So it is the first part that the rays come into contact with before it is refracted to the back part of the eyes. And then we usually have the white part. It's called the conjunctiva. So it basically it houses the outside and visible parts of the eyes. And then of course the eye has fluids, and these fluids are able to maintain the integrity of the front part of the eyes, as well as provide nutrients and nourishment to those parts. The first fluid is usually after that transparent part. It's called the aqueous humor. And then there is a fluid that it's towards the back part of the eye. It's called the vitreous humor. And then just in between those fluids, we have the lens. The lens of the eyes works as a normal optical lens. What it does, it enables the eyes to focus. Like it can be able to contract and relax so that you can be able to focus. And then of course the back part of the eye, we have the cornea, where now messages are being sent towards there so that they can be processed and transported to the brain for interpretation. Yeah, actually we say it is the brain that sees, because your eyes is just to take the message to the brain so that the brain tells you that this is what I'm seeing.
Okay.
Yes.
Okay, thank you very much for that.
Yeah.
We want to go a little bit deeper on this visual health, and especially the well-being of the eye for the children.
Okay.
Starting with the unborn.
Okay.
Is there anything that relates to the visual health of an unborn child? Is there anything a mother who is expecting can do?
Yeah, that's very interesting. Definitely there is something that a mother can do. Actually, the fetus starts to develop eyes at around 6 months of pregnancy. There'll be some dots that will form on the unborn baby. And of course, there's also be the formation of the optic nerve, which is the visual pathway to the brain. And so as an expectant mother, one of the most important things to do is to be able to aid in that development, because basically what is happening to an unborn child in their eyes is that their eyes are developing. It's structural developing. So the best thing that a mother could do is to ensure that they eat balanced diet, especially of fruits that can be able to aid in that development. Nutritionists encouraged a group of foods we call beta carotene. They are found in most orange fruits. They are found in blueberries, and this can aid in the structural development of the unborn child eyes. Okay. Yeah.
Now the child has been born. Let us look at 0 to 1. What are the things that you look at as a mother, as a father, on the visual health of this child?
Okay. Yeah. So when a child is born, they majorly depend. Of course, at that time, the eye is not fully developed because it will need certain things to be able to do that. And what we usually refer to as visual stimuli, they are the things that help the eyes of the child to develop. And these stimuli come from both the environment, and there's also the stimuli from the brain. Like the brain signals the eyes so that they can be able to take certain structural development. And so during that time is a very important period, because the child is developing their eyes to be able to help him or her to take the task later in life. Things like learning and other tasks like playing and all that. And so during that time, it's important for mothers to be very wary of their child's eye health, because any structural defect during that time can have very bad effects on their later lives. Of much importance is to ensure that your child eyes are checked at 6 months of age. That is the very first eye checkup they should have is at 6 months of age. But of course, even at birth, there are certain eye checkups that they do to ensure that the eye is functioning well. And then a thorough eye checkup can be done at 6 months of age. During that time, certain things have started developing in the eyes. The child can respond to certain stimuli, and the eye doctor can know whether this child eye is developing well or not. But it is good that the eye checkup is done at that time, so that if there is any defect, then it can be arrested earlier and the intervention is done. Okay. Yes.
You've talked about structural defects.
Yes.
What exactly are you referring to?
Okay, some children can be born with eyes with pupils that are not well developed, or they can be developed, or they can be born lacking certain pigments that are necessary for perception. So such kind of things are being investigated at 6 months of age, because at least at that time they are not fully developed, but at least they have started developing. Yes, and also structurally the eye is not the same as that of an adult. It will reach there at around about 8 years of age. But there are certain development milestones that needs to be met so that we can say that this child eyes is developing normally. Yeah.
Now, when you look at children with special needs, how do you tell from a very early age that my child's eyes, is leaning towards a certain, could I say special need, or towards a certain condition?
Okay. Well, depending on certain behavioral patterns that you observe on a child could be having a squint, if they are turning their eyes too much, because they are trying to compensate for the fact that their eyes is not seeing very straight. So you would observe their eyes are turning a lot. You could also observe this discharge in the eyes. Could mean that there is infection, or if they are rubbing their eyes a lot, it means that they have allergies that need to be addressed so that they cannot affect the child. It is important to note that during that time, the immunity of the child is not fully developed, and so any infection can really have detrimental effect on the child.
Okay.
Yes.
Okay.
Yeah.
Are there predisposing factors that surround the visual health of a child? The visual, let's even call it visual challenges of a child.
Yeah, sure, there are. Like I said, during that age, the child depends on stimuli, like the feedback that it gets from both the brain and the environment to be able to develop. So if we can put it rightly, the factors that can hinder the visual development of a child can be environmental, things in their environment. Nowadays, our generation is growing in a digital world. So you find that a child at a very early age, they are exposed to laptops and all that. They want to use the phones to play games and all that. So this is an environmental factor that can have an effect on a child's health, because they will be focusing more on near tasks, and that can have effects on their eyes. There could also be hereditary factors. These are now the factors that a child is born with. And of course, there are very many conditions that a child can be born with, including the clouding of their lens at their birth. They could be born with short-sightedness that they have inherited from their parents. So those are some of the hereditary predisposing factors. And of course, there could be other factors. We could talk of race. We could talk of we call it the eye health literacy. How a parent is aware or appreciate eye health. Yes, it can have a bearing on the health of the child.
Okay.
Yes.
So as a caregiver, you have identified that your child has a squint. Your child probably is not following objects when you move a finger. Are there things you can do at home as a caregiver that can help this child improve their eyesight?
Yeah, definitely. Usually when a child has a squint, and of course this should be diagnosed in a eye clinic setting. Of course, there are certain things. Normally, eye care at home is at the very basic level. The best management for most eye care problems or visual health problems should be done in the hospital. And even if it is done at home, it should be under the supervision of an eye health practitioner. But as you have asked, one of the things that a caregiver can do is to be able to be aware, like I said, eye health literacy, to be able to be aware that certain things can signal abnormality in a child. and so they are able to take appropriate measures to take the child to an eye clinic so that their eyes can be able to be checked. When a child is turning their eyes, like I told you, that could mean that they're having a squint, and so they need to be examined by an eye care practitioner so that they can be helped. Management for that normally varies. So the best a caregiver can do is to be alive to those things. Is there discharge? Is there abnormal eye rubbing? Is the eye red? Or is the eye abnormally white? Certain instances when the eyes are too white, it could signal an eye cancer, which is a rare case.
Okay.
Yes.
Okay.
Yeah.
Yes. So there are times that a caregiver may walk into a dispensary to just seek help.
Okay.
I'm just wondering, for the person who is not able to get to an eye doctor.
Yes.
What other professional can help? You're in a place where there is no eye doctor. What can that person?
Yeah, I like as somebody who lives in our side of the world, those are challenges that we experience of accessibility to eye health, because you find that even most eye health practitioners are found in major towns. So if somebody is in a far-flung place, it might be challenging to access some of these services. But nowadays there are community healthcare workers who are actually trained to identify very simple eye visual problems, and they can be able to make referrals. In fact, one of the things that is working very well in Kitale, rural Kitale, is that they have an app which can be installed in a simple Android phone, and then anybody trained can be able to make examination and do appropriate referral. So if this person can identify with an hospital that has an healthcare worker and who is trained specifically for eye health matters, then they can be able to identify those issues and then make appropriate referrals. Usually that is the best management strategy for those cases, especially where accessibility is an issue.
Okay.
Yes.
And because you're talking about early intervention,
Yeah.
Maybe you can just tell us how, is it very important to have early intervention, matters eye health, eye health care, or we have this culture in Kenya, ngoja kidogo, let's wait a bit, maybe it will clear.
Yeah.
So, yeah, how important is it to have early intervention?
Yeah. Okay. Yeah, actually there's also another culture where it's another quote that says, if it is not broken, don't fix it. Yeah. If something is not bad, you don't want to touch it, because but it is very important that early intervention is incorporated into our health system. In fact, one of the things that the World Health Organization has advocated for moving forward from what was called the Vision 2020, which was running from 1999, is to be able to have what we call the integrated people-centered eye care. And this now focuses mainly on the patient, people being people having eye health literacy, so that they can be able to know what their eye health is all about. Like you have said, it is very important even for our daily activities. But now back to your question, early intervention is very important because it helps to have any defect, any disease to be managed earlier before they become unmanageable. Let me give you an example. Like, for example, a child who has, let's say, squint, the brain can be able to stop signals from that eyes, because squint can have other effects like double vision and all that. And so when the brain stops signal from that eye will not grow. So later in adulthood, that eye will become lazy, like it will not be able to see because the brain was not able to send signals for it to develop. So early intervention is important so that certain diseases can be nipped in the bud before they become unmanageable. Early intervention is also important, especially for children, so that they can be well prepared for the learning activities that they have. Because learning requires different visual skills. The way you are seeing far, which you refer to as visual acuity, it requires visual perception, which refers to how you perceive certain things, colors included. It also requires eye teaming. Eye teaming is where now the visual skill required to read books. Yes, so it's that coordination that can be able to help the eye read book. So those interventions can be able to prepare the child for those visual skills, so that they can be able to learn well.
Okay.
Yes.
What are these conditions that arise for not taking the child for early intervention, like the lazy eye? I know you have told us about the lazy eye, but what could problems like, say, low vision or something, vision impairment arise? What are these things that would arise for not taking appropriate action?
Of course, the worst that could happen is blindness. It is on record, of course, with the World Health Organization that the main cause of blindness in Africa and of course in third world countries is uncorrected refractive error, which short-sightedness included, long-sightedness, and also the other one is cataract, which of course affects older people. But of course, one of the conditions that can cause problems when it is not managed is of course refractive errors. The other one of course is amblyopia, which is the lazy eye. This one usually comes towards adulthood, where now of course the brain does not send any signal to the eyes, and so the eye do not develop, and so that eye will become lazy to not see totally. There could be childhood cataract. Somebody is born with cataract, and that eye might never be able to develop. So that early intervention will ensure that the cataract is removed, and then the eyes can resume their normal development by relying on the stimuli from the brain.
Okay.
Yes.
All right.
Yeah.
Is visual health care the same as visual therapy?
Well, vision therapy is basically a branch of visual or eye care, and of course it's usually a very controversial area, because some eye health practitioners do not recommend it, because it's basically a structured program that it helps to train the eyes to be able to work better with the brain. Yeah, so it's a part of eye care. Yes, where somebody is taken through some structural trainings to ensure that the eyes and the brain work coherently.
Okay.
Yeah, so it's not basically the same, but it's part of eye visual health. Yeah.
Is it being practiced in Kenya?
Not that much. It's not being practiced in Kenya very much, because there are not very many places that focus so much on visual therapy. And like I told you, its use is still a little bit controversial, because some eye care practitioners do not advocate for it. But of course, its help is legitimate. Yeah, it has helped some patients, just to be able to develop some of these skills and restore the working of the eyes and the brain together. Yeah.
All right.
Yes.
Maybe our last question would be: you have a child with a special need.
Okay.
Now, when it comes to visual health care for that child, is the treatment the same? Say a child with Down syndrome, a child with autism. Is there a correlating factor between the special need and the eye, the visual health?
Yeah, sure there is. You have actually mentioned Down syndrome. A child who has Down syndrome will be exposed to a lot of eye health issues. And of course, it might even affect, not even it might, it will affect even their development, structural development of the eyes. And like I said, development of the eyes is dependent on both the stimuli from the brain and also from the environment. So, certain child with this condition, the way their environment is structured or the way they interact with the environment is different. And so this can predispose them to certain eye diseases that a general population might not be able to have. So for those children with special needs, they need very close coordination with eye care providers so that their eye health can be under intense monitoring, because most of them lose their eyesight because they focus so much on this other condition at the expense of the eyes. Yes.
In our parting shot, what would you tell our viewers and the people who get to watch us later?
My parting shot will basically be, last week there was World Sight Day, which is an international advocacy for eye health, and basically the theme that this year's World Sight Day had was "Love Your Eyes," and of course the first thing that will encourage people is to make a pledge, make a commitment to take care of their eyes, and the second one is to make "Love Your Eyes" a lifetime mantra. Just ensure that you get your eyes checked, you take care of them, because if you take care of them, they will also ensure that they take care of you. And then of course the last thing is to spread the message of love your eyes to other people, so that they can be able to also take care of their eye health.
Okay.
Yeah.
Thank you very much, Dr.
Thank you so much.
That was very informative.
Thank you.
We have really gained so much knowledge from your wealth of experience. Thank you very much.
Thank you so much. Okay, so 2 places. Of course, this is the day and age of social media. So I have a page, it's called The Favorite Optometrist on Facebook, where we give educational pieces there every week for just people to be able to learn about eye health. And then physically, you can find me in 2 places in town, on Accra Road and also in Komarok.
What is the name of the place where people can find you?
In Komarok, you can find us at Vine Eye Care. We're opposite Naivas. If you're around there, you can give us a call. In town, you can come at Everbright Optical Center. We are on Siriko Business Center on 1st floor.
Okay.
Yes.
Thank you very much. Yes.
Right.
And so now we have come to the end of our interview. We hope you have learned a lot. You're well equipped to just make the right decisions for your loved ones. Early intervention is critical. It is important to work with a specialist. Those who are not in a place where you can get an eye specialist, they are community health workers whom you can work with, and they can give you referrals. As gifted gems, we are in it together. Thank you, and God bless you.